Hi, everyone. This is Paul Pereira, Vice President of Patient Advocacy at Saniona. I would like to welcome you to Saniona's Community Voices, where we highlight the voices of people living with rare diseases, their caregivers, and the medical professionals who treat them. Today, we're here to talk about hypothalamic obesity, or HO. And no one knows more about HO than Dr. Ulla Feldt-Rasmussen. Dr. Feldt-Rasmussen is a professor at the University of Copenhagen and is the Chief of Medical Endocrinology at the National University Hospital in Copenhagen. She also serves on Saniona's Scientific Advisory Board. Welcome, Dr. Feldt-Rasmussen.
Thank you very much, Paul, for this nice introduction. I'm very happy to be here.
Can you explain what is hypothalamic obesity and how is it different from general obesity?
Hypothalamic obesity is a much more complicated disease than general obesity. They share, of course, the obesity in both populations, but for the hypothalamic obesity, there are other complications than just the obesity itself, because the hypothalamus is damaged. The complexity of the disease as it is depends very much upon whether you are a child and still growing and developing, or whether you are an adult who has already gone through development. The reason for the damage could be a tumor near the hypothalamus and pituitary area, which is very often both in children and in adults. So if you both have a weight issue from destruction of the satiety center or the hunger center, and you also have from the thirst center, you can see you have really nutritional problems and weight balance problems. But there are also areas in that region that take care of temperature. They are very close to areas that also take care of the 24-hour rhythm we have, which means you get sleep disturbances. You can have centers who are guiding other vital functions that are very complex for the patients to deal with in daily life. And the cognition is usually reduced because of this, these nearby other areas of the brain that can be damaged. And on top of that, of these things, the damage in the hypothalamus will also damage the hormones that go through the pituitary or stimulate the pituitary gland to produce the pituitary hormones that are controlling basically all our essential hormonal functions in the rest of the body.
What are the challenges that people with hypothalamic obesity face on a daily basis?
Well, of course, they have the challenges from, you could say, from their obesity, which in a way is, of course, similar to what other obese people are faced with. I mean, the obesity itself being very heavy, being unable to do normal physical functions very often. But on top of that, they have a very, very prominent hunger drive. I mean, they are hungry all the time. And that's because this center that should control satiety and hunger, when being damaged, then what's left is being hungry all the time. So, and this is of course 24 hours. It's around the clock that they feel absolutely controlled by, in a way, an uncontrollable hunger. So that is very complicated. And if they also then have the other complexities of other damages, temperature regulation, they get sometimes fever, they get sometimes chills.
What advice do you provide for parents after a child is diagnosed?
Oh, it's quite a lot of advice, really. The advice is really that they try to keep the patient in a schedule, a daily schedule, and see if they can get the patient to follow certain rules of eating behavior, certain rules of intake of tablets, and certain rules, of course, about sleeping patterns and schooling patterns, and paying attention to whether or not the child develops normally, goes normally into puberty, and go to a specialist. We also advise the parents that these children may need special assistance of some kind. It could be assistance in school. It could be when they grow a bit older and are going to be on their own.
Why is it important for patients to participate in clinical trials?
The hallmarks of good clinical practice is choosing treatment options, including medications based on evidence. This is what we've been taught, and which is the only thing really that can justify this or that choice of medications, that we make sure that the medication works, make sure that it doesn't give too many side effects. So it's very important that the patients are willing to participate if they are going to get a future medication that can assist them in the future.
Doctor, what innovations do you hope to see for hypothalamic obesity patients?
One of the innovations that we definitely hope to see is, better weight loss management. And in this particular group, that is very important because they have, due to this damage, they lack the satiety feeling. And it doesn't, you cannot restore it except by medications that act in the system, in the hypothalamic area. So this is one thing, but medication is not everything. It's important also that you have a system where the patient can get good and qualified, because daily lifestyle changes, daily weight management, also in terms of increasing their exercise level, getting advice from dietitians, getting advice from physiotherapists, and getting advice from their specialized physician. And it's really my hope that if we are going to help these patients everywhere, they need to have a specialized, centralized center, and not being scattered at different general practitioners, different even specialists, but be pulled together in multidisciplinary centers where the focus is just them and similar patients, and not a lot of other patients, because these need special care.
Doctor, thank you for taking time to meet with us and share with us your insights and teaching us more about hypothalamic obesity. Really appreciate it.
Thank you very much.